Good morning. My name is Vickie Rubin, and my husband Mitch and I are the parents of 3 children. They're adults now. Jessica, age 38, is our eldest, and she lives in a People Inc. group home. I'm going to bring you back to March of last year. Mitch and I drove to Florida. We were planning on staying there for a month, and we started hearing about a virus that was raging across the country, and especially in New York at the time. Our daughter, age 38, as I said, was living in a People Inc. group home, and she is severely disabled and part of a vulnerable population. And we knew we needed to get home because at that point, we didn't know, was People Inc. going to be able to still care for our daughter? Were the staff going to be able to come into work every day? It was all, we knew less then than we know now, and I know we feel like we don't know a lot now. Even though Jessica lives in a group home, we're still her parents. We're still her go-to people. We're still so much a part of our life. And then COVID-19 hit, and we became isolated from our daughter. We couldn't visit our daughter. We couldn't hold her hand or give her a hug. And we couldn't explain this to her because she's nonverbal and has limited understanding. Jess needs total assistance with all daily life skills. And without embarrassing Jessica, I just want to give you a little bit of what that means. Imagine caring for a 1-year-old child and all the things that you need to do, from dressing and bathing and toileting and feeding, everything. Now imagine that 1-year-old is really 38 and weighs 120 pounds. Add to that a seizure condition and complex health issues, and then you have our daughter. So imagine you are the direct service provider, the staff that comes in every single day. Not only do they need to remain vigilant at this time about the virus for themselves and their family, but they needed to remain vigilant for the women who lived in our daughter's house, because our daughter and her housemates were one exposure away from devastation. So the leadership at People Inc. and the manager of the house had to make sure the staff, the direct staff that came in, were on board and willing to do this. Imagine that all this work needs to be done and you're getting paid less than or equal to somebody who works in McDonald's. You really don't have to imagine this because all this is true. Direct service workers, direct care providers keep our daughters alive, and they don't make a living wage themselves. Low pay discourages people who really want to work in this field because they can't afford to work in this field. There's a high staff turnover because it's easy to get another job that isn't as much work, and that staff turnover then the management needs to keep training new staff workers. And for example, with our daughter, she has, as I said, a seizure condition and medications and different ways to lift her. And how do you do this? And how do you keep teaching? I have to believe that it's more expensive to keep retraining new people than to just pay a living wage to the people who are dedicated to our daughters. Reteaching new staff is not only time consuming, but it's very frightening to families. I know our daughter's seizure condition. We want somebody who knows our daughter, knows what a seizure looks like, and knows what it looks like after she has a seizure. So now it's the end of February, and Jess has had 2 vaccines. Yes, I've also had 2 vaccines, and my husband and I both had COVID. We are okay now. I think I'm on day 80 and we're doing fine. We do see the end. We do see the light at the end of the tunnel in terms of COVID. We are now able to see our daughter masked up, and we did give her a hug. And we are so grateful for the people who work in the house. But one thing, we do not see an end of the light, and that is for fair pay and a living wage for direct service providers. Be fair to direct care. These people are keeping our daughters alive. Thank you so much for listening, and I wish all of you safety and continued health. Thank you.